Hello everyone, welcome to my channel. Here is your doctor. So today we will learn about a very important topic from the nervous system. Before starting a video, if you are watching my video first time, then kindly subscribe my channel and like the video. So let's start. Guillain-Barré syndrome. The syndrome is named after the French neurologist Georges Guillain and the Jean-Alexandre Barré in 1960. Now look for overview of the Guillain-Barré syndrome. So GBS, it is immune mediated condition. Immune mediated means our immune system is involved. So it is also called Landry's ascending paralysis. GBS is autoimmune demyelinating disorder that leads to progressive paralysis. GBS is the most common cause of acute flaccid neuromuscular paralysis. Now look for the epidemiology of the GBS. So 0.222 cases per 1 lakh. Males slightly more affected than females. Now look for the definition of the GBS. GBS is an inflammatory disorder of the peripheral nerves outside the brain and spinal cord. It is a rare disorder in which person's body immune system attacks on nerves. It is a post-infectious polyneuropathy involving mainly motor nerves but also sometimes sensory and autonomic nerves. Now see for causes. So firstly we will see possible causes. Possible causes is first one is after the non-specific GIT in the respiratory infections like Campylobacter jejuni and H. pylori infections. Following administration of the vaccine, certain vaccines like influenza vaccines, but it is a rare condition. So after a major surgery or any trauma. Now look for the classical clinical features. Post-infectious symptoms occurs 1 to 6 weeks of post-infections begins in lower extremities. Initial clinical features is acroparesthesia. Now what is acroparesthesia? Form of paresthesia that affect the hand or feet, especially in the fingers or toes with numbness or with prickling sensation or burning. Ascending weakness and paralysis is an important clinical feature of the GBS and involves symmetrically proximal to distal. Within days cause areflexia or hyperreflexia. What is areflexia? Means absence of deep tendon reflexes. Diaphragm paralysis lead to respiratory failure. It is a neurological emergency. Now look for other clinical features. Other clinical features like blood pressure, dysregulation, urinary retention, cardiac arrhythmias, alter mental status. And facial nerve involvement, neurological pulmonary edema. One is Beaker stuff encephalitis, means inflammation of brain. Now look for the pathophysiology of the GBS. So GBS is an immune mediated process leading to polyneuropathies. Occurs post-infection or formation of the ganglioside antibody. So but how antibodies are formed? Lipopolysaccharide on outer membrane of the Campylobacter jejuni resemble the ganglioside of the peripheral nerve membrane. So these antibodies are attack on our nerve cells. Antibodies are GD1, GM1 and GQIB antibodies are formed. Now which attack on our peripheral nerve and activate the complement cascade and cause the damage of myelin sheath and affect the normal function. For the clinical variants of the GBS, first one is a Miller-Fisher syndrome, second one is acute inflammatory demyelinating polyneuropathy, third one is acute motor axonal neuropathy, fourth one is a pharyngeal cervical brachial variant, fifth is motor sensory axonal neuropathy. It is acute. Now look for what is the diagnostic criteria for the Guillain-Barré syndrome. First is progressive symmetrical weakness, more than one limb. Second one is hyporeflexia or areflexia. Third one is progression less than 4 weeks. We can also diagnose it through EMG or nerve conduction test, through lumbar puncture. In lumbar puncture we found normal WBC but elevated the CSF protein. Now look at for the management of the GBS. So active treatment with plasma exchanger or intravenous immunoglobulin therapy within 2 weeks, and 80% patients recover with 3 to 6 months after treatment, and 4% die and remaining residual neurological disabilities. Thank you.